So the aims of this workshop are to provide you with information on contracts, information on new schemes, to demonstrate the templates and searches that need to be used to maximize your uptake, and to highlight what CEG can offer you. So this is just a list of the local incentive schemes for BHR. So you have your AF, you've got your end of life, which is Redbridge only. You have your diabetes and injectable therapies. You have your latent TB, which is Redbridge only, and phlebotomy, which is participating practices only. And then you have your respiratory care, which is your asthma and COPD.
Billy Joe, we can't see the slides moving.
It's not me moving them, it's Tracy.
Tracy.
The slides are not moving.
No, we're still on the first slide.
Can anyone else see the slides moving?
I can see them moving.
Oh, you can see
Okay,
them.
they are.
Okay,
Yeah.
great.
Okay, fine.
So we know it's very confusing which template to use. So for any long-term conditions such as CVD, diabetes, all your local incentive schemes, including QOF, please always make sure you use our LTC templates. So for EMITs, it's LTC and LIS version 1.2, and for System 1, it's LTC and LIS version 1.3. For phlebotomy and for the latent TB templates, it is EMIS and System 1 is phlebotomy NEL version 3, and then EMIS and System 1 is your latent TB Redbridge version 1. As I mentioned, this is for Redbridge only. So this is just a quick highlight of our LIS information page. So here you can see when you're in the long-term conditions template, if you go to the LIS information page, you'll see exactly where to locate the searches, and then it will give you a brief description of every LIS that is available and what needs to be done. But we will be going through this in more detail as we go along. And then this is the same for System 1. I'm now going to pass you over to Tracy.
Okay, thanks, Billy. Okay, so I'm going to kick off with the AF. There has been a very slight change for your case finding, and that is that you no longer need to record suspected arrhythmia. So for your cohorts of patients, are you aged equal to or above 65 and over? They don't have CVD and they don't have AF. With these patients, you need to make sure that they have a pulse rate and rhythm recorded. And the work to be done is on the patients that have an irregular pulse. So irregular pulse, you would then need to make sure that they have a 12-lead ECG done within practice. But if you don't do ECGs within your practice, then please contact your PCN manager, who will be able to advise you who within your PCN will be able to complete those tests for you. And then depending what comes out from the ECG results, you would then code them with AF if it has shown that result. And that is worth £85 per newly diagnosed patient from the 1st of April 2025. And then for your newly diagnosed patients from the 1st of April 2025, you have 3 different elements that you need to complete on them. So this does have a change this year also. You are looking at, they must have a CHADVAS score, an ORBIT score, BP and BMI coded within 3 months of diagnosis. So that can be 3 months before or 3 months after. So this has been made slightly easier for practices so that you can complete the work. You do also need to have the discussion and provide the patient information leaflet as well within 3 months. And your smoking and alcohol, again, has stayed the same. As long as you have it recorded within the financial year, that's absolutely fine. So none of the stuff has to be done on the same day like it had to be previously, which is good because that makes it a lot easier for you to hopefully achieve the target for these. So all of the patients that you can do all of these things on, you will receive £42.50 per patient. And then you would then start initiating the anticoagulation. So again, as I've said year on year, the whole point of this, Liz, was to identify that practices initiate the anticoagulation rather than sending them to the clinics in the hospital to initiate. So what needs to happen is on the day that you have seen them, you would issue the medication. So you check their orbit score. If it's equal to or above 3, then you do refer them to hospital because you are unable to do the initiation at the practice. If it is 3 or below, that is when you take action. So you would give them the medication that you're issuing. So say, for instance, you're starting them on a Pixaban or a Doxaban. You then need to use the template, as always, with all of this information to code that you have discussed the anticoagulation. You issue the medication in the medication module. You must issue it. It cannot just be put in there to sit to be issued at another point in time. It must be issued at that time. So please make sure that that is done. And then that is worth another 28.33. And then once you've initiated the anticoagulation, you then need to do the follow-up. And this has had a slight change from last year also. It is now a follow-up appointment to be done 1 to 2 months after you have started the anticoagulation and coded anticoagulation therapy discussed. And you can still do this either on the phone or face-to-face, but you've got a couple more weeks extra time to be able to get this in. And you do need to factor in, if anybody does need to have a blood test redone before they have the follow-up, you do need to incorporate this in your timings of trying to get them back in for the 1 to 2 month period. So when you see them for the initiation, it would be best if you gave them the appointment already for the follow-up, and also the blood test form if they need it, and tell them to go for their bloods within 4 weeks, so then that they can have you can have the results back by the time they come to see you, say for instance on week 6, if that's when you would book the appointment for. So it's just trying to look ahead on this part and make sure that you're pre-booking in the hope that they're going to then come back because they already have a pre-booked appointment and they have their blood test already. You do have the section for MDT meetings, and again, this is optional. It's intended for complex patients only. They do have some stipulations on here. I'm not going to go into detail, but you will be receiving these slides. We will send them out, but you've just got the different identifiers there. There's 12 identifiers. Goes onto that page as well, and that is worth an additional 21.25. But again, that will not be on all patients. That will only be on the patients that it's required for. So as a roundup of that, money-wise, we just wanted to let you know that the potential earnings that you can get for these patients, if you confirmed that they were newly diagnosed and then you did the review on them, you could potentially get £184.16 per patient. If you newly diagnose them, review them, and they are one of the patients that you do discuss in an MDT, you could potentially get £205.41. If you are doing the reviews on the patients, if you do all 3 sections, your risk stratification, initiation of anticoagulation and the follow-up, it's £99.16. And if you did do the review and the MDT on the patient, it's £120.41. So that's just a roundup there, monetary wise, as to how much you can potentially earn on these patients. And then we'll just move on to show you, so your support searches, your top one is EMIS, your bottom one is System 1. You have dashboards available. This year we have now collated a lot of our dashboards, so there's one dashboard rather than 3 separates. You'll see that hopefully we've just added our dashboards online. So please do go and have a look, and you'll only be looking for one dashboard for each individual LTC, which is good. Okay, I'm just going to pass you over to Billy and she's going to go through diabetes for you.
Thank you, Tracy. So we're going to look into the diabetes. So you've got your 8 care processes, so nothing's changed there. You have been doing the same one for a few years now. So you've got your 8 care processes that need to be done within this financial year, and any new diagnosed patient should be referred to structured education program. So for the 8 care processes payments, these haven't changed. So you have your standard targets, which is up to 60%. You can receive 55p per weighted patient. You also have your higher performance target, which you can reach to 75 and receive an extra £23 per weighted patient. But please do remember, for this one, you also have your PCN target, which is a minimum of 60%, which is an extra 8p per weighted patient. So free treatment targets. So you have cohorts for your BP and HbA1c, which is your patients 17 plus, without moderate or severe frailty, and it does also exclude any newly diagnosed patients in the last 9 months. You have your BP patients on the diabetic register with hypertension should have a BP under or equal to 140/90. You have your patients on the diabetic register with CKD, stage 3 to 5, and hypertension should be under or equal to 130/80. And then you've also got your HbA1c, which hasn't changed. So this is a HbA1c of under or equal to 58. So it's about controlling the HbA1c with those patients with diabetes. And then you also have your CVD risk management. So the cohort for the risk management is aged 18 and older. So you have without CVD and without moderate and severe. And then this is looking at calculating the Q-risk score. So if it's equal to or above 10, they should be offered a low intensity statin, or declined must be recorded. And then for your patients with CVD, they should be prescribed a high intensity statin. For the free treatment targets payments, so you can see here they're all done individually. You have your HbA1c, which is 51 to 80. You have your CVD, which is exactly the same. You also have a CVD target for PCN, which is 58 plus, which will equal to an extra 14p per weighted patient. And then for your blood pressure, this is slightly different percentages, so it's from 61 up to 80% for payment. Here you can see you've got your support searches. Again, you've got EMIS at the top and System 1 at the bottom. And then your dashboard. So this dashboard hasn't changed. It's been like this for a while. It does look at all 3 areas in the one dashboard, as Tracy mentioned. And then you can have a look across the top. You've got your care processes, or you've got your free treatment targets tabs, which you can select as well, and your own areas or PCNs. We're going to move on to see if there's any questions. You can put these in the chat, or you can raise your hand and we can have a look at the discuss those with you as well. Ranjan, are there any questions in the chat?
Francine, you've got your hand up. Did you have any question? Nothing in the chat. Francine, do you want to turn the mic on?
The dashboards are located on our CEG website, but if you don't have the login details, then please do contact myself or Tracy and we'll send them over to you if you're not sure how you access our dashboards. I hope that's okay, Ian.
Okay, yeah, Francine doesn't have a question, so that's, you can carry on.
And thanks, Shauna. She's just put the link on there for the dashboard, so Ian, you can access it through that way.
Brilliant. So now we're going to move on back to Tracy, who will go over the injectable therapies.
Okay, thank you. Okay, so the injectable therapies has stayed the same. There's not much change on here. So you have your insulin and your GLPs. So your insulin is your diabetic patients that are age 17 plus, and they will have a HbA1c of equal to or above 64, and they will be on 2 or more oral therapies. and you must give priority to any of the patients that are on 3 or more oral therapies. And they need to have, so you would do the initial consultation with the patient, you'd have your discussion, you will then initiate what medication it is that you've decided. And then from the initiation, you're then required to do 3 follow-ups in the first month after they have started the medication. So our searches and our template has all the information on for you to record all of this. And then once you've done your 3 follow-ups, you're then required to do 2 repeat HbA1cs, and that is at month 2 and at month 6. So again, with this does require some planning in advance to make sure that you don't miss out on the timescales, because we are looking at certain timescales for the follow-ups and for the HbA1cs being repeated. And if you complete all of that, that is worth £250 per patient that you initiate insulin with. And then the GLPs. So again, it's exactly the same cohort. You do have a slightly different requirement. So you would do the initial consultation, and then you initiate whatever GLP you decide between you and the patient. And then you're required to do 2 follow-ups, and that is within a 3-week period after you've started the medication. So again, please do plan ahead with these and make sure you book the appointments in when the patient is there with you. And this is worth £94 per GLP that you initiate with any patients. There is a dashboard that is available for this. You do also use the LTC template for this, as you do with the AF and the diabetes and the majority of the LISs that we are going through. The injectable therapies, again, is one that is all in one. All of you are on the same dashboard there. I'm going to pass back over to Billy, and she's going to go over respiratory for you.
Thank you. Next slide. So firstly, for respiratory, you have your case findings. So these are case finding patients to see if they have COPD or asthma. Then it's about you confirming these diagnoses. So if you confirm the diagnosis through spirometry, for COPD, you would receive £110. And if you confirm the diagnosis post a pheno diagnostic test, then you will receive £23 per pheno. So these are for newly diagnosed COPD or asthma patients. And then they should also, for quality, be offered smoking cessation for this. So now we're going to move on to the asthma annual review. So there has been a slight change this year. It's looking at your cohort of 18 plus on the asthma register, which is normal. And then what needs to be done this year is for the annual review box needs to be done. And also you need to provide a personalised action plan for those patients. And this is worth £6 per asthma annual review and the PAP action plan as well. So they both need to be done for the £6 payment. And then for COPD, it is also looking for annual review and a personalised action plan. And this is worth £10 per annual review and the action plan completed. So they both have to be completed for these payments to be made. And then here you have your support searches. You'll see clearly you have case finding searches, and then you also have your asthma review and action plan payment ones and your incomplete searches there as well. And that's both EMIS and System 1. Again, as we mentioned, the dashboard now is looking for all of BHR, so one dashboard now for all areas. You have 2 tabs, so you've got a report quarterly tab, which is looking at the case finding, and then you have your monthly report, which is looking at your actual annual reviews and the activity that's being done. For this dashboard, we're no longer looking at baselines of the 1st of April, so these will be activity based. And now we're going to move on to phlebotomy. So this is your NEL phlebotomy specification. So it's only for participating practices. So for this, it's all patients. If a patient is unsuccessful, you must refer them to a community pharmacist. And if you are taking bloods for other practices, you please ensure that you are recording blood sample taken on behalf of another practice. So the template to use for this is your nil phlebotomy template, and it will guarantee you're using the correct codes. So for this one, you'll receive £4 per blood sample taken, £8 per glucose tolerance test, and £16 per home visit for a blood sample taken. This is currently our NEL template. So on the left-hand side, you can see EMIS. So this is the NEL phlebotomy template. And then on the right, you can see System 1. And as you can see, you've got your stars which need to be done for these payments. And then there is also a dashboard, which you can see clearly across the top. It will tell you how many normal blood samples you've taken, how many glucose tolerance tests, and how many home visits you've taken. And it also does record the unsuccessful bleeds, and if you've taken them by another practice or who needs to be referred. Are there any questions?
None in the chat.
Okay, I'll pass you back to Tracy and she'll go over the RedBridge schemes.
Thank you. Okay, we have an updated one for RedBridge this year. The updated is end of life, and you do also have a new latent TB Liz that started on the 1st of August. We'll start with end of life. So this has changed to what you have been doing previously. You must now, you have a register, so your patients added to the register after the 1st of April 2023. This will be excluding those that live in a care home, and you must use a certain register to record these patients, and that is the On Gold Standards Palliative Care Framework. I have popped the code on here, so like I said, you can get the slides, but this is also reflected in the template as well. It will be looking for these codes. So if you do have any patients that are previously coded with any other register, please do go in and change it. And then you've also, to remove a patient from the register, you need to use the palliative care not clinically indicated code, because sometimes that is the case that it may have accidentally been added on, or that they are no longer on palliative care, so you can take them off. And so review patients that are added to the register before the 1st of April 23, so that you need to go through and recode those accordingly with one or two of the above codes. Okay, so what work is required? You are required to do UCP, so your urgent care plans. You are required to do reviews and updates of care plans, and also MDT meetings. Your urgent care plans, you can earn up to £200 per new urgent care plan. So anyone that's just come onto the palliative care register, so from the 1st of April 2025, that will earn you £200 for doing a new urgent care plan. And then you need to do a review on the patients and also keep their care plan up to date. You can receive £100 per review or care plan that you do, but it is capped at a maximum of 2 reviews. So say, for instance, the patient went on the register on the 4th of April, you could do one, you do your new UCP, then you could do another review, say in July, and then you could do another review in October, and you'll be paid for all 3 of those. So again, it's making sure that you use the LTC template to make sure everything is coded correctly and you are using the correct codes for this local incentive scheme. And when it comes to the MDT meetings, you would be required to discuss all patients, and then this is paid per quarter. So you can have a minimum quarterly payment of £300. But like I said, it's making sure that everything is recorded correctly. So for this, the MDT part, you would use the separate CEG MDT meeting template to record that, to make sure you have that they've attended an MDT meeting and also who has attended those MDT meetings. So again, just to highlight, the new urgent care plans does have an exclusion, and it is excluding anyone that lives in a care home. So here's a screenshot of the template and what it looks like. It's very short, there's not too much on there, but please make sure that this is being used so that you can get the correct payments that you need if you've completed the work. And then there's your System 1 version as well. Your support searches are located here, so EMIS at the top and System 1 at the bottom. You do have a dashboard. So the dashboard you are seeing is looking from the 1st of April up until the 31st of July. And then there will be a change from the 1st of August onwards once that's been produced. So your potential earnings, if you was to complete this, so new patients on the end of life register, you can potentially earn up to £400 if you do the UCP and then complete 2 reviews throughout the year. For patients that are already on there and you're doing a review, you can earn up to £200 per patient for the year. And then, as I said, with your MDT meetings, they are £300 per quarter, but you must make sure that you record all of the information. Okay, moving on to your latent TB. You have an eligibility on here. So it's looking at anyone that is new or existing within your Redbridge practices. They must be aged 16 to 35. They've not previously been tested or had TB. They were born or have spent 6 months in a high dependency TB area, and they must have arrived in the UK within the last 5 years. And what's required for you as a practice or federation, whoever is doing the work for you, you must record that you've invited them. You must record that you've offered them the screening. And if they decline, you must also record that too. And what you're going to be paid on is the IGRA test. So you'll be paid £10 per IGRA blood test that is received and recorded. And then what happens is, if one of the patients does come back with a positive reading, you are then required to send them for a chest X-ray. Once you get the chest X-ray results back, you must send those results with the referral to the specialist TB service in BHR UT. So that is the one thing to remember, is if they have a positive test, they must have a chest X-ray done and the results must be sent with the referral form to the TB service. And here is your template. So you're currently on version 1 for this. Again, it's not very big, but it has all of the information on there. And again, what I will highlight is, because it has come to our attention, as a practice, if you are not doing the work, then please do have a look at the coding to make sure everything has been coded correctly. And the way you can do that is just by opening up the template on the patient. And as you well know, if it will give you the information that's been entered in already. So you can just cross-check what's been entered into the consultation to make sure it's exactly the information that needs to be recorded on the template for you to get payment. There's your System 1 version. And then the support searches are located here. Okay, so we're going to do a live demo. I'm going to pass over to Billy. Billy's going to go through the EMIS searches, and then I will go over the System 1 searches once Billy's finished.
Thank you, Tracy. I'm just going to share my screen.
Sorry, Billy, VJ's got a question.
Yep, do you want to come in before we share?
Yeah.
Yep.
Sorry, it's about the end of care life. I have a few questions. Can I ask at the end, then after this demo, or?
Yeah, that's fine. Yeah, we'll go through the demo and then we'll answer them for you.
Okay, thank you.
Thanks, VJ.
Okay, can everyone see my EMIS?
Yes.
Okay, so firstly, you'll see that we've got our practice support searches out, which are for 25-26. So if you haven't copied these over, please do so. And within these, you have your separate folders. So you've got your ICB contracts, which is where you can find all your local incentive schemes, which I will be going through. And then you've got your public health, which will tell you who's eligible for your NHS health checks. You have your PCN support folder, which has, for example, your IIF support searches in. We have our QOF and DES, and CQRS support, which you can find your RSV manual CQRS submissions and some other searches in there. You've got your immunizations and vaccinations. So in there, you've got your flu vaccinations. Additional support, these are any additional support searches that we offer you, so for like incomplete registration. And then we do now have this external created resources, and this is at the moment looking at nil prescribing. So we're going to go through the ICB contracts folder. So in here, you can see how am I doing? And then within here, you've got all your folders. As we mentioned previously, end of life and latent TB is for Redbridge only. So we'll have a look at your AF. So in here, you've got, like before, it's the same, very similar layout. You've got your case finding here at the top, and then you will have payment in brackets for all the payment ones, and it will have the tariff here as well at the bottom to tell you how much or if there's a PCN target. It's the same again for newly diagnosed AF patients. You'll see here, and it does give you a brief description of what needs to be done. And then, like before, we have incomplete restratification, so incomplete reviews, and then you have your missing criteria report. So please remember, when you're viewing the missing criteria report, just go to view results. Obviously, I can't do that here because patients are hidden. But you would go to your view results, and then you'd see a table which will show you anything that's missing for any of those patients, and you'll see what's required across the top. And we do provide the same for the discussions and follow-ups as well. And then for your diabetes, again, we have here your 8 care processes completed. And here you can see here, it will tell you the minimum threshold, and it does mention that higher and PCN targets. And you have your missing criteria report. So please do always check these, and it will tell you why this patient is showing in the incomplete. And then again, we've got our payment searches for your free treatment targets. End of life, so you've got how am I doing? So this looks at quarterly. So for Q1, you'll be able to see here clearly how many new reviews have been done and how many reviews of patients that are already on the palliative care register, how many they have been done, and then the second review here. So these are new end of life care plans, and then these two are reviews. Also in here, you have support searches, which will help you with those patients currently registered on the end of life since 23 and need to have a review done. And then you've got here those that are currently registered on the end of life, coded since April 25, and that they're excluding care home and they're missing their new urgent care plan. And then we do have some data quality searches here as well, where it looks at if patients been put on the register before the 1st of April 23. These are those patients you can review and see if you need to recode these patients as they're still under palliative care. And then you have here looks at weekly care home visits, but they're not currently coded as care home. So these are more for you to review. You have your injectable therapies, and it does look at obviously all the follow-ups that Tracy mentioned. So it's very clear here how many follow-ups need to be done and when they need to be recorded for HbA1c, and then the same for the GLP. You have your latent TB searches, which are for Redbridge only, as mentioned. It then looks at if the patient's had an invite, if they've been offered, declined, and then if they're positive, have they had a chest x-ray completed or declined, and have they been referred to the TB specialist? So it's very clear here, and then you can look at your existing patients. So these are your new registered patients, and these are your existing patients, which look at the same things, it's just different cohorts at the top. And then you have your respiratory, which is both your asthma. You have your case finding search here. So these are case finding for COPD and asthma patients. And then you have your asthma reviews and action plan, and then the incomplete. Please remember, these missing criteria are coming off of the incomplete searches. So just to be very clear, we've had a couple of queries. So the missing criteria will be coming off of the incomplete ones. And then you have your same for your COPD. I am going to pass back over to Tracy now, and she's just going to go over briefly the show you the layout of System 1, so it's very clear where you can find the support searches.
Thanks, Billy. Okay. Again, so this won't take very long because it does have exactly the same layout as what Billy's shown. You do have subheaders though, so this does make it a little bit easier for you in System 1, as they are a lot of information altogether. So for your AF, you can see your number 1s are your case finding on here. Your number 2s are the risk stratification area that needs to be done. Your number 3s are your initiation of anticoagulation. And then your number 4 is your follow-up for your AF. You can see on an individual basis on some of the searches, it will say with the information. And then in other sections, for instance, for diabetes, it will tell you the patients without, because you're trying to achieve the 8 care processes. So they do differ just depending on the LIS that we are talking about. And as I said here, so your diabetes, number 1 is your 8 care processes. So as you can see, it's got patients without a BP. So you can see on a singular individual basis which 8 care process they are missing. And within System 1, as you well know, you don't have missing criteria reports like you do in EMIS. You need to click on your search that you are looking for, and then select your report output maintenance and click the correct report that you're wanting to look at. So for instance, this one, you'll be looking for your diabetes payment report, and that will tell you who has everything and who doesn't have everything. And then your number 2s, again, they work exactly the same as Billy explained with the different age groups. So you've got your 17 plus is for your BPs, which you've got your BPs here with below 140/90, then you're below 130/80s, and then your HbA1cs. And then your different criteria for your statin patients are here. These are your 18 plus there. You've got your end of life searches, and again, they work the same. You've got your how am I doing? So this will tell you on the quarterly basis exactly what's been done. So you can see end of life care plans, the reviews that have been done, and then the second reviews. You've got your same recall and support searches on number 3. And then number 4 is the data quality as well. Your injectable therapies searches are also there. So again, exactly the same as how they are in EMIS. Your LTBI, again, exactly the same there. You can see you've got your 2 different cohorts, your newly registered patients, and then your currently existing patients as well. Your respiratory is slightly different, as you well know, it's set out separately. Here are your asthma reviews. You can see if they've had the review code done only. You can see if they are fully completed, and you can see your incomplete. Again, you would use your report output to identify which part is missing. And that's the same for your COPD as well. And then your payment searches are separately. So they're down here on your respiratory payment. You just click on these ones you'll see here. This will tell you who's been completed with the annual review and the asthma care plan. And then this is going to tell you who's had the COPD review and the COPD review care plan done as well.
So what we offer is practice support visits. So these can be your annual support visits. They can be your APL training support visits, or they can just sometimes be a Teams meeting if you do need to discuss some areas with us, like your contracts or templates. We have our practice support searches, which we've been through in detail, so you can see clearly where they are. We also have our CEG templates, and like we mentioned, for any long-term conditions or your local incentive schemes, the main template to use is your LTC, apart from some of the newer ones, which are phlebotomy and LTBI. We have our dashboards, and as you know, there is a link put in there for you, so you can access our dashboard. And if you're unclear about anything or how to navigate it, please do contact myself or Tracy. You have your APL tools, so these are your childhood IMS recall tools. You have your cancer audit screening tools. We have an AF new version coming out as well. We have our renal tool. So there are quite a few tools. If you're unsure about them or want access to any of them, please do contact us and we can send you the request link. We have our monthly drop-in sessions. And in these drop-in sessions, we do go over any practice queries. Sometimes we have a focus session as well, so we'll be going over specific areas. But it is mainly for practices to guide in which you would like us to discuss as well. And sometimes we do some training areas on the APL tools. And then we also have our webinars as well. And in here, it's just the links for our drop-in sessions for each area, so you can see clearly and you can just join if you are available. So these are monthly, but these are the next ones that are available for you. DJ, I can see you've got your hand up. Is that an older hand or a new one?
No, last
Yeah.
one about the latent TB. It's
Mhm.
latent TB is done by HBD. If we do in the surgery, will we get paid or how it works?
So with this, I would contact HealthBridge just to confirm who is doing the work. But like I have said, just to have a peace of mind at practice, just check the coding, even if HBD are doing it.
Because I went through the searches, I saw one of the patient they have done already HBD, so I
Okay.
think they are only going to work. So okay,
Yeah.
I'll check with them. Thank you.
Okay.
Thanks.
Are there any more last questions at all?
Can I just say the Apple tools, APL tools are really, really useful, especially if you're, for CQC and, areas where you need to focus on any clinical aspects of the work and meeting your targets. So try and get your clinicians to use the APL tools for identifying patients who need certain assessments.
Okay, thank you all for attending. I will put in the chat shortly a feedback form, so if you could complete this, we would much appreciate that. But if you do have any queries, please do contact myself or Tracy and we'll be happy to help you.